everyone, welcome back. We're going to finish out this chart and then we're going to move on to the next two chapters and medical terminology. So we left off with magnesium. Magnesium is imperative with muscle function, contraction, relaxation, that sort of thing. The next thing we'll talk about is myocardial infarction. This is a heart attack. It's also known as ischemia. Ischemia. All right, I have a video of that, and then also a MICU, a more mobile intensive care unit. This is like an ambulance on steroids. So I'm going to show videos for both of those.
Approximately 7 million people around the world die from heart attacks every year, and cardiovascular disease, which causes heart attacks and other problems like strokes, is the world's leading killer. So what causes a heart attack? Like all muscles, the heart needs oxygen, and during a heart attack, it can't get enough. Fatty deposits, or plaques, develop on the walls of our coronary arteries. Those are the vessels that supply oxygenated blood to the heart. These plaques grow as we age, sometimes getting chunky, hardened, or inflamed. Eventually, the plaques can turn into blockages. If one of the plaques ruptures or cracks, a blood clot will form around it in minutes, and a partially closed artery can become completely blocked. Blood flow is cut off to the cardiac muscle, and the oxygen-starved cells start to die within several minutes. This is a myocardial infarction, or heart attack. Things can rapidly deteriorate in the absence of treatment. The injured muscle may not be able to pump blood as well, and its rhythm might be thrown off. In the worst-case scenario, a heart attack can cause sudden death. And how do you know that someone is having a heart attack? The most common symptom is chest pain caused by the oxygen-deprived heart muscle. Patients describe it as crushing or vice-like. It can radiate to the left arm, jaw, back, or abdomen. But it's not always as sudden and dramatic as it is in the movies. Some people experience nausea or shortness of breath. Symptoms may be less prominent in women and the elderly. For them, weakness and tiredness may be the main signal. And surprisingly, in many people, especially those with diabetes, which affects the nerves that carry pain, a heart attack may be silent. If you think that someone might be having a heart attack, the most important thing is to respond quickly. If you have access to emergency medical services, call them. They're the fastest way to get to a hospital. Taking aspirin, which thins the blood, and nitroglycerin, which opens up the artery, can help keep the heart attack from getting worse. In the emergency room, doctors can diagnose a heart attack. They commonly use an electrocardiogram to measure the heart's electrical activity, and a blood test to assess heart muscle damage. The patient is then taken to a high-tech cardiac suite, where tests are done to locate the blockages. Cardiologists can reopen the blocked artery by inflating it with a balloon in a procedure called an angioplasty. Frequently, they also insert a metal or polymer stent that will hold the artery open. More extensive blockages might require coronary artery bypass surgery. Using a piece of vein or artery from another part of the body, heart surgeons can reroute blood flow around the blockage. These procedures reestablish circulation to the cardiac muscle, restoring heart function. Heart attack treatment is advancing, but prevention is vital. Genetics and lifestyle factors both affect your risk, and the good news is that you can change your lifestyle. Exercise, a healthy diet, and weight loss all lower the risk of heart attacks, whether you've had one before or not. Doctors recommend exercising a few times a week, doing both aerobic activity and strength training. A heart-healthy diet is low in sugar and saturated fats, which are both linked to heart disease. So what should you eat? Lots of fiber from vegetables, chicken and fish instead of red meat, whole grains, and nuts like walnuts and almonds all seem to be beneficial. A good diet and exercise plan can also keep your weight in a healthy range, which will lower your heart attack risk as well. And of course, medications can also help prevent heart attacks. Doctors often prescribe low-dose aspirin, for example, particularly for patients who've already had a heart attack, and for those known to be at high risk. And drugs that help manage risk factors, like high blood pressure, cholesterol, and diabetes will make heart attacks less likely too. Heart attacks may be common, but they don't have to be inevitable. A healthy diet, avoiding tobacco use, staying fit, and enjoying plenty of sleep and lots of laughter all go a long way in making sure your body's most important muscle keeps on beating.
All right, so I thought that was a good video that kind of outlined what a heart attack is. It's generally it's ischemia. It's holding back blood from part of the heart. That's what causes a myocardial infarction, which means the muscle of the heart. Myo is muscle, cardio is heart, and so myocardial infarction is lack of blood flow in the heart. All right. So the next one that I talked about was a MICU. Okay, and a MICU is kind of like an ambulance that takes critical ICU patients from from one facility to another facility for an interfacility transfer.
In today's Your Healthy Family, I'm telling you about a new state-of-the-art ambulance that UC Health has on duty in southern Colorado. It's a mobile intensive care unit.
This is a 2-year project that has brought this ambulance to us from Florida.
The new mobile intensive care unit was delivered last Friday and officially goes into service next week.
It will help bring critical care straight to our community and our outlining areas. It actually allows us to start critical care at the facility, at the community level, and bring them to the tertiary center, which is UC Health Level 1 Trauma Center, which is the busiest trauma center in the state at the moment.
This ambulance won't be responding to 911 calls, but will use its specialized equipment to safely transport critically ill patients from facility to facility.
All ambulances have the ability to offer basic BLS or ALS care, depending on their qualifications. We're the only one that allows critical care, which is advanced cardiac ICU care that brings that to the community. It has capabilities to lock in safety-wise some of these advanced pieces of equipment that sick patients need. Balloon pumps, Impella devices, advanced fetal monitoring. It has the ability to lock all that in a safe environment so that we can move it from one point to another and keep our patients very, very safe in doing so. So we take the ICU to them.
For Your Healthy Family, I'm Ira Cronin. For more health stories, head to yourhealthyfamily.com.
Okay, so it's kind of like an ambulance on steroids. Has the ability to have specialized equipment in it, which is imperative when you have.
In today's Your Healthy Family, I'm telling you about.
A patient that requires advanced care. All right. So next is minute. Okay, right there's 60 seconds in a minute. Okay, there's 60 minutes in an hour. So MIN is minute. ML. So again, that L can be capital or lowercase. That's milliliter. There's 1,000 milliliters in a liter. Okay, a milliliter is the equivalent of 1 cc or 1 cubic centimeter. Okay. All right. Next we have medical laboratory technician, which, surprise, I have another video.
Medical technologists, also known as clinical laboratory technologists, perform and analyze the results of complex scientific tests on blood and bodily fluids. These highly trained professionals work in hospitals and independent laboratories using sophisticated procedures and equipment. When test results are analyzed and completed, medical technologists collaborate with physicians or laboratory directors on patient data. A bachelor's degree in medical technology or science is required for entry-level positions. Medical technologists analyze samples of blood, tissue, and bodily fluids to determine chemical content, cell count, drug levels, or blood type. They may also search for specific microorganisms like bacteria or parasites. Preparing the samples for examination, using automated equipment and specialized instrumentation, performing numerous complicated tests simultaneously, and accurately interpreting the results are all part of a medical technologist's job. Whether in a medical facility or independently run laboratory, medical technologists often work with infectious specimens. Infection control and sterilization protocols must be followed to minimize these hazards. Medical technologists can also expect to spend many hours standing in a laboratory. Hospital employees often work irregular hours or are on call for emergency situations. The day to day duties of a medical technologist include complex analysis of microscopic, immunologic, biologic, bacteriologic, hematologic, and chemical tests and their results. Some tasks that a medical technologist might be asked to perform could include preparing cultures of tissue samples, establishing and monitoring programs that ensure data accuracy, microscopically examining slides of bodily fluids, cross matching blood for transfusions, chemically analyzing blood or urine for toxic components, analyzing lab reports for accuracy, operating and calibrating equipment, delivering test results to physicians, researchers, or patients, and collecting and studying blood samples to determine morphology. According to the U.S. Bureau of Labor Statistics, BLS, a bachelor's degree is the minimum entry level requirement for a medical technologist. Advancement to laboratory director is a relatively common career step for medical technologists, and this position usually requires a master's degree. Bachelor's degree programs in medical technology, clinical laboratory science, or allied health technologies all prepare students for work in this field. These 4-year programs are heavily focused on the natural sciences and often include an internship. Common course topics include anatomy and physiology, lab management, immunology, clinical microbiology, parasitology, and medical ethics. Depending on the state, medical technologists may need to be certified before they are licensed or registered, according to the BLS. This often includes proof of a bachelor's degree and a written exam. State boards of occupational licensure or departments of health administer medical technologist licensure. While not required, employers may prefer to hire medical technologists who are professionally certified. Specialized medical technologists can become certified through organizations that administer to their specialty. The American Medical Technologists (AMT) agency offers a professional AMT designation. Applicants must have a bachelor's degree from an accredited program and either a recognized medical technology internship or a year of approved experience to sit for the written examination. The BLS projected that the number of jobs for medical and clinical laboratory technologists would grow at a rate of 16% between 2014 and 2024. Over 50% of medical and clinical laboratory technologists were employed by hospitals as of 2014, while the rest worked in laboratories, physicians' offices, or colleges and universities. Additionally, the BLS reported that the median annual salary for medical and clinical laboratory technologists was $60,520 in 2015. Medical technologists perform tests and analyze results in a laboratory setting. A bachelor's degree is necessary to enter this field, and certification may be necessary.
All right. So that's medical technology. They do a lot of stuff. It's a pretty interesting job field. A lot of my friends in college um, went on to get masters in medical technology. And they do quite well for themselves, and they really enjoy it. All right, millimeter. Millimeters. It's like a centimeter, but smaller, right? So there's 10 millimeters that go in a centimeter, and 1,000 millimeters that go in a meter. All right, MOD. This is moderate. Okay, you can say moderate. You can use this to describe pain. You can use this to describe a level of something. It's a moderate level. It's not excessive. It's not um, deficient. It's moderate, in the middle. This isn't mom like your parent mom. Um, this is milk of magnesia. So it has magnesium. Magnesium, if you remember, is imperative at helping your muscles expand and contract. Okay, so milk of magnesia you generally take if you have Oh, excuse me. Oh, some sort of gastrointestinal cramping kind of helps with that. MRI, magnetic resonance imaging. So we'll pick up with this on the next video. So stay tuned, and I am going to have a video for this. So thank you very much.